First, I like to talk to the patient and find out what has triggered their fear of the dentist. Was it a bad past experience with it? Was it something they heard from a friend or a family member, or something maybe even in the media?
We're taking somebody's history and their memories of how it was and recreating a trusting relationship in a comfortable, more supportive environment. It involves some distraction techniques, just like the Sony Walkman I used in dental school. Now it's iPods, now it's television, virtual reality glasses to watch DVDs, having aromatherapy in the office to diffuse the dental smell, etc., medicinal smells. I even have a massage therapist come in for long appointments and do reflexology and foot massages on my patients. They have chairs that have massage elements in them. So we're basically just completely recreating the dental environment and pay more attention to be able to relax patients in the chair. But nothing is more important than the basic human-to-human communication skills, and it really has to start from there. So a dental spa in and of itself with all these amenities is great, but the doctor still has to learn psychology and learn how to properly communicate and develop proper listening skills.
Once I find out what that dental fear is and what's triggered the fear, we basically talk about it. Most importantly, we make the patient understand that A, we have compassion and we understand the importance of that fear, and also that we are not going to recreate the problem that caused that fear in the first place. If they're afraid of pain, we let them know what techniques that we can use that can alleviate pain so that they don't have pain during treatment. If they're afraid of gagging, we have techniques and materials that set quickly so that the impression materials, for instance, aren't in the mouth as quickly. We can use topical sprays that numb the mouth so that it makes impressioning easier. Sometimes it's a control issue. You know, that people are phobic because they don't like the idea that they are losing control of themselves, you know, to the doctor, to the dentist who's treating them. In cases like that, what I like to do is I like to give the patient a measure of control over the situation. If they want more information about why we're doing the treatment, we do it and we work together, and that really helps to alleviate the anxiety as well. But the most important thing is communication. Really understanding what it is that makes people afraid and what triggers these phobias, and then working with the patient to overcome those fears.
Listen, listen, and listen. Throughout all of medicine, doctors' listening skills need to be improved. A patient comes in with fears and wants to tell you their background, and I ask and I encourage them to talk, and I say, I want to know, why are you fearful? What has happened in the past? And allowing them to express themselves and their sense that you are truly listening, not just blowing them off, creates this catharsis effect where you build up a trust right away because they realize how unique it is that a doctor is actually listening to me. Ask questions, listen to the answers, and you have to give the patient a sense of control. Give them a mechanical hand-raising signal to stop you at any point, and they'll test you too. It doesn't have to be just if you feel something. You want a breather, you want to spit, you want to just take a breath. Any way you can give a patient control and proper listening communication skills by far trumps any iPods or fancy little devices that we use. I mean, it's great to have all these high-tech gizmos, but low-tech human-to-human interaction is really the basis of everything else working.
A lot of times the dentist is pressed for time, they're hurrying with their schedule, they don't take the time to really listen to the patient and don't take the dental fear that a patient has seriously. Patients resent that. Every dentist needs to listen to their patients and to take their dental fears very seriously and do whatever they can to help the patient overcome those fears and treat them with dignity and compassion and in as painless a manner as possible.
This is real. It's a real problem, and it takes real solutions. The reality is that sedation and general anesthesia does not conquer fears. It simply allows patients to be put to sleep, allowing a doctor to mechanically fix their teeth. They wake up, the fears are still there. Even though maybe you get some of the dentistry done, it often is mechanically compromised as well, because when you're sedated, a lot of quality control steps that are common in dentistry to check the bite, check the fit of things. Short little appointments are skipped over because it's not practical to put people to sleep to try something in, so they miss fittings. Envision going for your wedding dress one time, boom, you get what came off the shelf. So there is absolutely no desensitization of those fears, which occurs with our behavioral approach. We believe that that's primarily based on communication, proper listening skills, establishing a trusting, caring relationship, setting a comfortable environment, highly trained staff to support those efforts. The general approach of conquering their fears systematically over time so they can maintain themselves is the common bond that holds practitioners like Dr. Gordon and myself together. Fear is a learned response. Therefore, it can be unlearned. That's why behavioral psychology can work. Dr. Gordon and myself in the Dental Comfort Zone and any member of our International Organization for Dental Phobia Treatment all believe in the same principle that fears can be treated behaviorally without the use of drugs.